basically the countries, all the products that are there at the exhibition itself are products of the country itself. So it's great to actually take a trip down there and take a look for yourselves. The prices are excellent, as you just heard. And now let's move on with our second guest for this evening. Now, our second guest for this evening is Professor Hussein Dashti, a consultant surgeon and Vice Dean, the Faculty of Medicine, Kuwait. Professor Hussein, welcome to the show.
Oh, thank you.
And of course, today, a lot of people might think we're seeing consultant surgeon and Vice Dean of the Faculty of Medicine. They might think that we're going to be talking about surgery or different, technical things that they might not want to hear all about. But no, that's not what we're going to be talking about. We're going to be talking about a program, a dietary program, which is, to a lot of people, they might recognize the name but not know much what it's about, and it's Dr. Atkins. Of course, basically, Professor, before we continue with this interview, I'd like to just inform our viewers that we are coming to them live, and if they have any questions, please feel free to pick up the phone and call. Our numbers will be scrolling on your screens very shortly. Now, Professor Hussein, you're a surgeon, and basically, dietary program, what's the relation between both? Why are you pursuing a different role?
Well, we know that the obesity is one of the biggest problems facing our society. It's not only in our society, even all over the world. Mm-hmm. So majority of diseases are related to hypertension, cardiac diseases, heart failure, heart problems, diabetic, and so on, hypertension, and so on. So the surgeon do the work by doing certain operation. But if we can manage the condition by conservative management, by instructing certain program to the patient, and trying to avoid as much as surgery is concerned, I think we are getting better success in this field. So the main problem that this society, as I mentioned, all over the world is facing this problem is because of the obesity is becoming a big number, and the heart disease is number one, and death and mortality in all over the society because of the civilization, because of the consuming of certain diets, which we are going to talk about it later in more detail. So what I'm trying to say that if we can succeed to do some work to help the society, to help the people, to help the patient who is suffering from certain diseases, and really they are dis-ease that the patient is suffering from this problem, I think we can contribute something to the world or to our society and to our people.
So, Professor, basically what you're saying is that sometimes you can actually avoid surgery if a patient manages to go on a proper diet and reduce his weight?
Absolutely, in case of the obesity, for example, or in case even if the surgeon wants to do some operation, minor operation, and if the patient is obese, the surgeon is reluctant really to do an operation because of the complication of operations, and an obese patient is really big problem. Right. So usually we advise people to reduce their weight in order to get a good result after operation or post-operation or post-operative management. So it's really mandatory. And the surgeon enjoys to do operation in a patient who is really in good shape rather than to be an obese.
Right, so this basically minimizes the risks after the operation. If a person is fit and in good condition.
Absolutely, exactly. That's what's happened. And I mean, a majority of the complication which occurs among the patients who are obese. Right. Who really has got certain problem, and obesity also associated with diabetic in majority of cases. So if we can prevent such problems, I think the surgeon can do good job.
Right, and also, Professor, I believe that at hospitals where a patient is scheduled for surgery, if that patient is overweight, they have to put him on a diet in order to reduce their weight before the surgery, because it makes it very difficult for the surgeon to perform the surgery in an effective way.
Absolutely, but of course the patient will not be admitted to hospital unless he is in good shape. So the advice will be given to him or to her and how to control his or her body weight. And apparently, if we can succeed in this program, which I found it's really a good program and helps the patient, I think why not?
Okay, well, now moving on to the program itself, Professor, I'm sure a lot of our viewers are very anxious to learn more about it. Now, we all know that there are so many dietary programs. You see them all over the place. When anybody wants to lose weight, they keep telling you, oh, have you seen this is a new protein diet, or a new soup diet, or they keep coming up with all these different dietary programs. And some of them work, some of them don't work, as we know. Some of them could have side effects that will actually weaken the patient's condition if they're not having proper nutrition with their diet. So what makes this one special, the diet that we're talking about today?
What made me really to be interested in this program exactly, because it scientifically agrees with what physiological